There is a reason hospital bills feel irrational. I'm Dr. BenMaamer, board certified general and vascular surgeon, and I see what happens when pricing system distort medical care. The problem did not start with the insurance. It started earlier. Most people think hospital just overcharge. Insurance company are greedy. Doctors set the prices. Bills are random. And that sounds logical until you look at the structure. And let me tell you about the villain of the healthcare in America, the Chargemaster. And almost nobody understands what it is. The Chargemaster is essentially a massive internal hospital price list. Every item, every medication, every supply, every service. It's like a second menu. But here's the problem. The numbers on this menu is often, they have no relationship to real market value or to reality, actually. So why did it start? Historically, hospitals need a baseline list price. Insurance reimbursement models require a reference point. Cost shifting become normalized. And over time, the baseline kept rising. Negotiations were based on inflated numbers. Discounts were applied to these inflated numbers. And when you negotiate crazy numbers, you still end up with a crazy number. And that is the distortion. And this is why it broke the system. The system built itself on the wrong foundation. Insurance companies respond by negotiating percentage of the Chargemaster. But the percentage of irrational pricing is still irrational. Then, employers pay more. Premiums rise. Deductibles rise. Patients feel punished. Doctors are squeezed. Everything is built on a distorted starting point. And when the starting point makes no sense, everything layered on top makes no sense. And this is the part nobody likes to talk about. So what happens when pricing is disconnected from reality? Transparency disappears. Patients cannot comparison shop. Bills shock families. Trust erodes. Administrative complexity explodes. And we keep trying to fix healthcare without addressing the foundation. If the base numbers is artificial, the entire negotiation is artificial. You cannot stabilize a system built on distortion. So what could actually change? And here is, in my opinion, the reform question. What if we removed the Chargemaster model entirely? Instead, true cost-based pricing, transparent service bundles, market-aligned pricing, clear surgical package rate, insurance negotiating from reality, not inflation. If you reset the starting point, everything above it stabilizes. This is not about attacking hospital. It's about correcting structures. I don't explain this to create outrage. I explain it because the structure determines outcome. Good systems produce predictable pricing. Distorted systems produce chaos. In Fort Myers and across Florida, patients feel this distortion every day through rising premiums and unexpected bills. As a surgeon, we operate inside the system, but that does not mean we don't question the foundation. And if you believe healthcare in America needs structural reform, hit follow. We are building momentum one conversation at a time.